Okay, so this is going to be principles of medical care on Shabbos. So last time we kind of covered, are you allowed to sign up to non-Shem Shabbos residency? This time we're going to be going over kind of some of the functional principles of how do you actually give medical care on Shabbos. So this is going to be the basic Halachik legal support for medical measures on Shabbos. So I like to think of it as BLS for the soul. Now, obviously, whatever we go over is just for your edutainment. It's really only going to be a background. It's not going to be in place of professional medical or halachic advice. The function of this is just to have people familiar with the sugya so that everyone can kind of be as best informed as possible.
If I would just add, I think in this particular lecture, that's extremely important because we touch a lot more on the gray areas that I think you'll see. And I think if you were to kind of just run with it and think this is sort of the end all and try to poskin from it, you'd be in a really bad place. So I think that disclaimer is just really important, specifically more for this lecture.
Yeah, the details are really going to be important, and none of the details really should be taken out of context. And it's gonna strike an interesting balance between halachic attitude that we have that life takes precedence over all, and when are we overreacting, and that really is a judgment call that should be reserved for both medical professionals and for halachic practitioners. Now, as we said, we've been using sacred training as a guide. This week's content is going to be culled from chapter 20, though I took a little bit of license. The first 10 pages I didn't really go over. This goes over the kind of the second half of the chapter. And I also called a lot of this information from Nishmat Avraham. I would recommend using the Hebrew version of Nishmat Avraham because there's a lot more there. The English translation is missing a lot by design, but the Hebrew not only is more authoritative, but also has a lot more sources. And I would also recommend the Hebrew version of Shmir Shabbos B'Hilchasa by Rav Newport, also a Talmud of Rav Shem Zalman Auerbach, just like Nishmat Avraham. Also, I would recommend the Hebrew. Okay, so just to give a little bit of a preface, and this will become clear why we need this preface in just a bit. So the Torah tells us we need to keep Shabbos, and then we can't do Malacha, and then we need to rest on Shabbos. Now, as you can see in these psukim that are quoted, the Torah really doesn't define what resting on the seventh day of the week actually means. Rabbinically, that's to say, based on our Masera, based on our tradition, we know that that Shabbos and the building of the Mishkan were juxtaposed. We know that the same phraseology of resting from work is used both by the Mishkan as well as by Shabbos. And so we learn in the Gemara, so the Gemara here on Daf Mem Tes, Amabez quoting a brisa says that you're only chayav for malacha, you're only liable for a biblical prohibition if the biblical prohibition was done as work is defined by the Mishkan. So that's to say, just like in the Mishkan they used to plant, so too you're not allowed to plant on Shabbos. And it goes through the other 39 malachas. And this is an important point, because when we think about work and rest on Shabbos, work and rest are not defined by their lay terms. So kind of like an interesting paradox. You're allowed to walk with a screaming toddler up to the 15th floor of a building. That's not considered work on Shabbos when you may be very well exhausted. And when you get up to the 15th floor and actually enter your apartment, you're not allowed to turn on the air conditioner. So that kind of highlights that when we say work and rest on Shabbos, these are kind of borrowed terms, are roughly translated at best. And obviously here we're taking the halachic definitions. We're going to try to figure out what you are and are not allowed to do. Another important caveat is that malacha on Shabbos you're only chayav on a biblical level. If you do that malacha, what's prohibited is doing that malacha as it's normally done. So, for example, if you're doing it with a shinoi, you're doing it in a non-normative way. That's to say, if you are if you're carrying something with your foot, or you're carrying something with something that's not your hand, that is not the way you'd normally do this malacha, and therefore it's only rabbinically prohibited, not biblically prohibited. Now, while this may sound like splitting hairs, the designation of biblically versus rabbinically prohibited is going to be important, as we're going to see different classes of infirmity warrant different levels of violating Shabbos.
Yeah, I would just to add on a little bit, I would point out that when we talk about the biblical and rabbinical prohibitions, and you mentioned doing something with the shinoi and it's not regular way, and how that would immediately change, even if you were doing an action that's typically biblically prohibited, but then you did it in a non-normative way, that turns it into a rabbinic prohibition. and then we talk about things that are just in general rabbinic prohibitions. And so I know within this conversation it could get a little bit confusing because there are different things that we mean when we say rabbinic. So just keep in mind that as we go on, hopefully in future videos, we'll be discussing specific case by case, like typing notes on a computer on Shabbos and where that falls into place. A lot of this is really just setting the background of just basic ideas of what is biblical and what is rabbinic, but don't get bogged down too much with like the case by case specifics, because we'll try to cover case by case specifics and encounters that you may run into a little bit later.
Yeah, so on a granular level, we're definitely going to be going through these topics kind of more at length. It also wouldn't be practical to go through 39 classes of work on Shabbos, of malachas on Shabbos, because there's considerable argument as to what's actually considered as part of that. And we'll touch on some of those topics, especially when we get to electricity on Shabbos, because electricity, it didn't exist as a functional technology until the 18th, 19th century. So yeah, right now we're really just going to be dealing with the legal classifications. We're going to bring some examples, but like Moshe said, they're really just there to stand in for building this lattice and intellectual framework. So now we know that you're not allowed to do malachas on Shabbos. Are there any cases that you would be? So just a quick refresher from last week. So we brought the drash of Shmuel. So Shmuel says, "V'chai b'hem, v'lo sheyamas b'hem." That you should always live through Torah mitzvahs, quoting a pasuk. That you should never die by them. That's to say that no mitzvah should ever bring to death. There's only 3 examples of mitzvahs that you would have to sacrifice your life for, but any other mitzvah should never lead to death. And he takes this very far, saying that anything that has a sakana on your life on Shabbos, you would violate Shabbos and not keep Shabbos. And that really keeping Shabbos in that case is going to be by violating Shabbos. The Rambam takes this further. And so he historically was living in the 11th century. In the 11th century, you had a group of people called the Karaites. The Karaites were this class that were kind of an offshoot of normative rabbinic Judaism, and they held that we're not going to accept what the rabbi said. We're not going to accept their Messiah. We're only going to go by the writ. We're only going to go by the written Torah. And so they didn't learn this drash of Shmuel, and they said you're not allowed to do. Even if a person's life is in danger, you wouldn't be allowed to violate Shabbos. So the Rambam has a very strong verbiage here when he says, if you're hesitant to breaking Shabbos in the case of pikuach nefesh, he says, "Ve'elu hapikursim." He said only apikursim, only apostates, only kind of people who really are on the far extreme, beyond what Judaism would warrant, would ever have an issue with violating Shabbos, and therefore any procrastination in violating Shabbos is considered apostasy according to the Rambam. So that's the Rambam calls you an epicurus if you're hesitant here. The Shulchan Aruch possibly goes even further, and he writes that a person that finds someone who's a sakana, it's a mitzvah to violate Shabbos for them, and whoever is faster at violating Shabbos is praiseworthy. And a person who asks questions or really calls the Rav to ask for a psak, he's a murderer. So hesitating by Chil Shabbos in this case, you're between a rock and a hard place. You're either an apicurus or you're a murderer, depending on the Rambam's verbiage or the Shulchan Aruch's verbiage.
As really an extension from the first video we did, where not everyone may have seen our first video, but we framed our conversation that there are 2 ways to look at it. We know how stringent Shabbos really is, and there are sources to say that you have to spend everything to avoid breaking Shabbos, and then we see such strong sources. This is an extension of those really strong sources to show how important saving a life is. It's not that Shabbos goes by the wayside. It's not that Shabbos is not stringent. It's how stringent medical care is, and that's something we see always echoed through all major opinions echo those thoughts. And so I think what we showed really emphasizes that, how stringent saving a life is, but not to take Shabbos lightly.
Yeah, and there's a great story from the Grach, from Reb Chaim Soloveitchik, the scion of the Brisker family. I'm not going to go over the whole story here, but the punchline of it, the story is on the slide, and it's actually written well. I took this from Rabbi Jachter's Grey Matter. The punchline of it is that his contention was that when we're lenient about Shabbos, it's not that we're being lenient about Shabbos, we're just very machmir by pikuach nefesh, and that's something that we're gonna see in the next few sources, that we take a very stringent view as to what is risk that constitutes the ability to violate Shabbos. reading Shulchan Aruch and reading the further rabbinic literature, you'll find 4 to 5 categories of what constitutes infirmity on Shabbos, what constitutes risk to life. So the first classification, that's really the classification that we're going to be laying a lot of groundwork for in this segment, is a chayil sheyesh bei sakana, a patient who is, whose life is threatened by illness. Long story short, which we'll be getting to the elaboration, all life-saving measures are allowed. The point of contention is going to be, are you allowed to do something that's accessory to the person's healing process? That's to say, a non-life-saving measure. And do you have to minimize? Do you have to use actions like a shinui? And that's what we're going to be discussing now. We're going to be discussing a few more fringe cases, prophylaxis and stuff like that, to figure out how far can these principles be taken. In later segments, we're going to go over sakanas aver, which is when a person's limb is in danger of dying, when a person who's deeply uncomfortable, can't function, but is not in danger of his life. Someone who has a slight illness, like a bad flu, and michush, a slight headache. Those are all classifications you're going to see in rabbinic literature, and each allow different kind of allowances, so to speak, for when you're allowed to violate Shabbos. Do you violate a biblical prohibition? Do you need to use a shinui? Can you only violate a rabbinic prohibition? Can it only be done through a Gentile who Shabbos is not binding to? And those topics will all be discussed.
So a lot of what we discuss when we say, pikuach nefesh, someone's life is in danger, we're talking about that specific category, but obviously medicine's not all life-saving things. And so most of the time we'll be probably dealing with patients in other categories. So it seems like everything we've been talking about till now was mostly sheyesh bo sakana, that there's really
so I guess a quick word on what is a chayil sheyesh bo sakana. And I think in general, inpatients, here's just a general heuristic, and we'll clarify this. In general, inpatients are going to end up being chayil sheyesh bo sakana, and outpatients are going to be chayil she'ein bo sakana. Generally, the premise with a patient with cellulitis that has to have monitoring and is on IV antibiotics, that's actually considered a chayil sheyesh bo sakana. Person with a bad pneumonia that's in the hospital that you're monitoring his vitals, even if it's not in an ICU, those are generally all considered a chayil sheyesh bo sakana. And we're gonna try to kind of thread the needle and figure out exactly where that line is, and that highlights our question. So, what is risk, right? What is risk in the term in the context of Shabbos? What index of suspicion kind of warrants the breaking of Shabbos? So, regarding this index of risk, and this is actually an example that's heartbreaking, but feels relevant in this moment. So, I don't mind spending a little bit more time on it. So, Misha nafal olav mapayla, someone who was covered by a building or covered by an avalanche, and you're not sure if they're alive and you're not sure if they're dead. You're not sure. Are they Jewish or not Jewish? Regardless of their status, right? And there may be many legal questions here whether or not this is a real case of pikuach nefesh. The halacha is you violate Shabbos and clear the avalanche, clear the debris, even though there are many sfekos. And the phraseology here is actually important. It says afal pi sheyesh bo kama sfekos, even though there are many questions. That's to say, even though your index of suspicion whether this is a real case of pikuach nefesh is very small. Now, the Shulchan Aruch writes this, but still you do have the question, okay, something as germane as a fever. At what point does this fever become life-threatening, right? Again, trying to really define what is a life-threatening event. So Ramesh finds actually has a great tshuva on the matter. And his verbiage, just the way he clarifies it, is actually very telling. As it gives us kind of a kernel to think about, a pearl to think about. So he's asked if there's a certain degree, any temperature in specific that we can say is life-threatening. So he says, no, you can't really define whether this is dangerous or not. And this is quoting from Igris Meisha, Simin Kuf Chavtes of Chelak Aleph. He says, Dal Safek nami mechalin, v'chol she'adam choshev l'zeh Hashem hu cham b'yoser mechalin. He says, even on a small index of risk, even on a small level of risk, you're also giving Mechal Shabbos. And as long as a person is worried about it, that is the type of case that we're going to say that you're allowed to be Mechal. In other words, he's saying that it's inherently going to be a little bit subjective. And the heuristic that you're going to use is your concern. How concerned are you, both as a patient and as a doctor? Are you really concerned about the clinical picture? If so, then you're going to be Mechal Shabbos. And if not, and he actually tries to give a basic heuristic. I didn't quote it. He gave 102 degrees. If it's 102 degrees, you can Mechal Shabbos, just because the rabbi was actually asking him. And this rabbi's name was Aaron Jacobs, no relation. But by the way, when he says 102, the Tzitz Eliezer in the next publication of Tchumen, I think, lambasts Rav Moshe Feinstein for trying to give a clarification. Is 102, maybe 101? Yeah, and this kind of, it really defies an exact appraisal.
I recall when that was shared with a group of doctors, I think most people were pretty surprised that 102 was the level he set as almost very arbitrary. I think most
Yeah, so
physicians know 102 doesn't really mean necessarily.
right. So if you read the first half of the tshuva, he really says it's a much more subjective feel. So whenever you, the clinician, you, the patient, really feel like life's in danger, whoever is best informed to make that decision in this case is going to be the one that's trusted. Okay, so we said who's ever best in the case to make that decision. Let's clarify that a little bit. So this is brought down in Shulchan Aruch and Siman Shin Chav Ches. So the case is a doctor. Doctors are in disagreement. Some say that this patient is in a life-threatening situation, and others say that the patient is not in a life-threatening situation. The halacha is you're going to follow the most lenient opinion, so to speak. Or let's rephrase that. You're going to be as most machmir about Safek as possible, and you're going to always follow the doctor who is more worried. This gets, the Shulchan Aruch goes further and says, in a case where the doctor says, this is a pneumonia and I'm not worried about you, but the patient says, I'm really not feeling well. I feel like I'm decompensating. In that case, you follow the patient, right? We're always going to go by the more lenient approach, so to speak. So now what's the limiting factor, right? What's the limiting level? Us as clinicians, when are you going to decide that now is a good time to break Shabbos? Now it's not a good time. Now's not a good time to break Shabbos. So Nishmat Avraham comes with another very convenient heuristic, and he says, use the Tuesday rule. He doesn't use that exact phraseology, but the Tuesday rule is whatever you do on Tuesday is what you're going to do on Shabbos. If you'd be concerned about this patient, you'd send him to the emergency room on Tuesday. That's the level of suspicion that you need to use on Shabbos. So in other words, best practice, whatever you would do normally, is really the judgment call that you're going to make.
I would just frame that just because I know that I've been in situations where I know if the patient were in this situation on Tuesday, I definitely would have told them, go to the emergency room and debated, well, now that it's Shabbos, this could technically wait. If it were Tuesday and I was not thinking about Shabbos, I would say, just go, no point in waiting. But debating, that in the case where it is Shabbos, does that warrant waiting? Because it technically could wait. I think this is a great tool because if it weren't Shabbos, you wouldn't have that thought at all. Sort of pretend it's not Shabbos and do what you would do. Because if you're starting to think it's Shabbos and you start to second guess yourself, what's really dangerous, I think that becomes a much more difficult call to make. So this is, at least from my thinking, this has been very helpful in trying to understand cases.
Now, just to give a little bit more of a clarification based on what we said about the Shulchan Aruch, in the case of a difference of opinion between the doctor and the patient, so in Nishmat Avraham, this is quoting again from that bit on Shin Chav Ches. All of this is pretty much called from the same chapter. He's asked the question, okay, what if the patient feels that their life is in danger? The doctor says categorically this is not. So in that case, he says we're going to actually follow the doctor. And so when do you follow the patient and not the doctor? Let's say it's a case of a bad case of flu or hypovolemia. The doctor says, you know what, the blood pressure seems fine, the patient seems stable, and the patient says, no, I don't feel stable. In that case, you would follow the patient. So if the doctor says categorically this is nothing, this is possibly a panic, maybe we should figure out some way to calm you, but this is not a case, that you're not having a heart attack. In that case, you'd follow the doctor's opinion because objectively, this is not a life-threatening situation. But in a case where it's one of those spectrum cases where the doctor's saying, in my clinical opinion, at this point, I don't think I would be worried. If this was slightly worse, I'd be worried. And the patient's saying, I'm worried about myself. You would follow the patient's call in that case.
So I would just maybe you can clarify and tell me if I have this right, but it seems like the question is more subjective, meaning the doctor saying, hey, this doesn't seem like it doesn't seem so severe, you have to go to the emergency room. Whereas the patient saying, no, I know myself and this feels off, then we would go by the patient. But if the doctor is giving an opinion that seems not even subjective, but more objective, like, no, I really know what's going on. I know for a fact that this is just, like you said, maybe like a panic attack. And I know that it seems scary, but I know objectively there is no danger here, then we would go by the doctor, even though the patient's saying, I really need it. Is that like
that's a fair appraisal. And we're not saying that you wouldn't be able to bend some halachic rules, so to speak, that's to say, violate Nishmat Rabbanan and maybe get the patient some sort of treatment. But we're saying that the biblical prohibitions would not, in that case, be as easy to skirt. Now, okay, so now let's go to a slightly another side of these fringe cases of the pikuach nefesh. What about prophylaxis? how do we, in our schema, think about, okay, this is not dangerous in the moment, but it could progress into something dangerous. There's an interesting case in Shulchan Aruch. This is, I think, Shin Chavtas. Shin Chavtas, where there's an army, there's a militia that's coming close to a city, and they're going to encircle the city, and there's either a pogrom or the bandits are coming to attack. In that case, the Akram Shitzar al Aretz Yisrael, there's a Jewish community. Is the Jewish community allowed to set up a perimeter on Shabbos or not? And the halacha is categorically you're allowed, even if you've only heard that there is a militia that's thinking of coming. You know that they're not en route, but they could be en route eventually. In that case, categorically, even as a prophylactic measure, you're allowed to violate Shabbos, kind of categorically. And the Mishnah Berurah clarifies this somewhat vague part of Shulchan Aruch. It says, even though they haven't come yet, you're allowed to defend yourself. And he goes further and says, by the way, even after this case is finished, you're allowed to come back home. You're allowed to come back home with your weapons because, fine, you've defended yourself against this skirmish, but you may need your weapons at home to defend yourself against a following skirmish. And this, by the way, is also going to be the basis of the psak of how ambulance drivers are allowed to drive back to base even after responding to life-threatening call. So this is, in another context, are you allowed to drive back home from the hospital is also going to be an important source.
So just to analogize to our understanding of medicine, had you known that an army were going to come to attack, you would obviously, that's a case of pikuach nefesh, that's similar to a patient being, actually in sakana, and therefore, dare I say, you're allowed to break Shabbos. This is, though, where you're not actually under attack. You heard you may be under attack. So this is similar to more of a case where not the patient's in danger right now, but can be in danger. Sort of like a one-step remove. Is that the analogy we're making?
Yeah, and now we're going to try to take this a step further, right? And so based on this jurisprudence, Rav Newport and Shemir Shabbos Hilchasa talks about an interesting case that's actually quite germane to the age of COVID. So he says someone has caught some infectious disease; they're not in a critical condition, but you're afraid that someone else may catch it from them, and eventually this may catch on to someone else. What are you allowed to do for this patient? So he says you're allowed to get a medical transport on Shabbos, take this patient who's not critically ill, take him to negative pressure room to quarantine him away from everyone else. So here, the patient's not in danger. He's not necessarily immediately putting anyone else in danger. And in that case, even as a 2 or 3 degree separation, you're allowed to quarantine this patient violating Shabbos. There's another case that's brought here. The text is all in the PowerPoint. Even 2 degrees of separation. Now, how far does this go out? What's the limiting principle here? Are you allowed to go get your vaccine on Shabbos? Those are all topics. Are you allowed to work on a vaccine on Shabbos? Are you allowed to work, do medical research on Shabbos? That all needs to be spoken about with a competent Rav.
I think this is where we were saying that disclaimer comes into play. We see that you can always trace a line back into someone being in some sort of danger. That doesn't give you the license to always, in every situation, just find that connection and violate Shabbos. And I think that's what we were saying earlier. That's where it comes to go getting a Rav and discussing on a sliding scale. We're along that line of tracing something back to actual sakana. Do we actually allow you to break Shabbos?
All right. Another interesting French case. What do we do in a case where you're not really sure what the halacha is, you're not really sure what the medical reality is? Let's say you didn't, you heard that someone might be critical, but you don't really have any corroborating whatever, or you have a fringe case, api halacha, and you're not really sure what the psak is. What do you do in those cases? You can't contact a Rav, or it'd be inconvenient to. So Rav Newport came out with the psak, and you can read this in Nishmat Avraham back in that chapter. So he says, if it's a Safek, you're always going to err on the side of caution, and by that we mean you're going to be Mechal Shabbos. So if there's ever a question, you're always going to be more makel, and then you're going to ask questions later. And that goes back to the way the Shulchan Aruch wrote it. Hashoyel harizeh shevach damim. He who asks the question is already spilling blood. So your questions could be for after Shabbos, 2 days after Shabbos, but on Shabbos you're always going to err on the side of caution. Now, another fringe case. What do we do about psychiatric danger? That's to say, the patient may pose risk to themselves or to others. Does halacha recognize psychiatric endangerment or not? And the answer is absolutely. In an interesting psak, that Nishmat Avraham brings down here. He says that, this was a case where there's an autistic child. The child could only be calmed down by being driven around. And sometimes the parents would drive around for hours until this child would fall asleep. Their question was, he's really irate. He's really not comfortable. He can get violent. Are we allowed to drive him around on Shabbos? So he says, it really depends on how dangerous this child is presumed to be. If he's dangerous to himself and others, you're definitely allowed to. If he's not a danger to himself, but he is very irate and he's not feeling well, his advice was, call a non-Jewish taxi driver before Shabbos. You're even allowed to go with him in the car. As long as it's a derabanan, you're going to be allowed to. So, and this comes with, it goes back to our principles conversation. You do need to understand what's a derabanan, what's a deraisa in each granular case, because it's very relevant. So this case, if the patient wasn't dangerous to themselves and others, but was deeply perturbed, you would be allowed to, in this case, according to Nishmat Avraham, you would be allowed to be over a melacha derabanan because he has the classification of a chayil she'ein bo sakana. That we'll get to. Okay, so now we've, kind of just to summarize, we've gone through what a malacha is. We've gone through the different classifications between a deraisa and a derabanan. We said that for a chayil sheyesh bo sakana, you're allowed to violate all biblical prohibitions for this patient. All life-saving measures are allowed, even cases that are fringe cases that are prophylactic. That are for psychiatric reasons or are a Safek, those are all categorically allowed. So what do we do though about non-life-saving measures? And this is coming back to reality. When you're in the hospital and you're doing things for patients, they're not always necessarily life-threatening, life-saving measures in themselves. Are you allowed to warm up your patient's food? Are you allowed to turn their TV on? Are you allowed to adjust their bed? Those things are not per se medical emergencies or medical interventions. Would that be classified as life-saving or non-life-saving? And this takes us back to our conversation we kind of started in the last segment about Dechuya versus Hutra. And I thought it would be interesting to bring one example of a Gemara where this conversation comes up in the Rishonim. So Rav Ulla, the son of Rav Ilai, said, all the needs of a sick person can be done through an Armai, through a Gentile, someone who's not Jewish, can be done on Shabbos. And just like Rav Amnuna, because what did Rav Amnuna say? He says, Rav Amnuna said something that there is no danger, something she'ein bo sakana. Tell a guy to do it. Okay, so this is an interesting Gemara because we're gonna find out that there's a big argument in the Rishonim. How do we look at this? What was the status of the sick person? Was the sick person someone that was a chayil sheyesh bo sakana, or was the sick person someone who did not have their life in danger? Was a chayil she'ein bo sakana? And that's going to color kind of how we understand this. Rashi takes a very simple approach to this Gemara, and he says. We're talking about a person who is in a critical condition, but if you don't do this intervention, they're not going to die. So he says a guy can do that, a yid can't do that. That's Rashi's position. So a non-life-saving measure for a critical patient is not allowed to do through a Jew. A non-Jew must do it. This comes into the face of what kind of the more Sephardic approach. Rashi, living in Provence, was kind of the beginning of the Tosafot, and then definitely the beginning of what you can understand to be Ashkenazic halacha, living kind of in the generation right after Rabbeinu Gershom. If we go to the Gurush Sfarad, we go to everyone kind of on the other side of Europe. The Maggid Mishnah as well as the Tashbetz take a very different attitude. They read a Rambam in a certain way, and that takes them to a very different approach. And just to go with the Tashbetz, because I found just the way his phraseology in the Tshuva was really, really clear. So he says, and in the case of a patient who's under a life-threatening, critical condition, Shabbos is pushed away. And this verbiage is important. It's functionally a weekday. Functionally a weekday for everything. Okay. And anything that this patient needs is carte blanche. Shabbos is here, Shabbos is there. Shabbos doesn't exist for this patient or anyone dealing with this patient. This is brought down in the Shulchan Aruch. The Mechaber, Yosef Karo, coming himself from Gurush Sfarad, takes this psak and he says in Shulchan Aruch Chaim Chas Halacha Daled, in a case that anything that this patient says that they need done, and anything that you would normally do for them on a weekday is what you do for them now. The Magen Avraham clarifies what the Mechaber says here, and says this thing that you would do for him, anything that you would do for this patient on a weekday, he says it sounds like what the Mechaber is saying. being that he's probably quoting from the Radbaz and from the Tashbetz before, even something that's not a life-threatening, that's not a critical intervention, even a non-life-saving measure is allowed. Now, how far do we take this? Right? What's our limiting principle here? Are you allowed to, are you allowed to do their taxes on Shabbos? Are you allowed to, make sure that this, patient can have, access to their telenovela on Shabbos? So the Chavadas, Rabbi Vadia Yosef, really clarifies this, and his tshuva here, brought down in the Chavadas, which is brought down in the slides, really goes through this in kind of the most authoritative way. If you want to understand what the Sephardic ruling is, what the Sephardic psak is, his limiting principle is basically anything that the patient needs done. You want to warm up his food, you want to adjust his bed, all those things are allowed, which, by the way, are much more problematic than the Ashkenazic approach, as we'll soon see. You don't need to use any shinei. The only thing that you wouldn't do for this patient is if it's really not involved in the care of the patient at all. So you're allowed to distract them, you're allowed to give them, more morphine, you're allowed to do really whatever you want for this patient. It has to be medical. It has to be in the class of medicine. You're allowed to turn on the radio for them. You're allowed to turn on their TV if it's going to distract them and make them feel better, and let the time go on. They'll be less anxious. You wouldn't be allowed to, though, do their taxes.
So maybe just to clarify, summarize a little bit, seems to me that we have the divergence between more like the Sephardic Halachik consensus and more Ashkenazic Halachik consensus about when treating a patient who is in that first degree category, right? They're they are like an actual danger. According to the Sephardic authorities, you would be allowed to do even things that are not particularly the life-saving event. So including things you mentioned, like just making them comfortable or making sure they have food to eat. But Ashkenazic rulings seem to be favoring the side of no. The life-saving measure, yes, that you can be over deraisa for the someone who is that sick. The life-saving measures, yes, but the secondary measures, no. And that seems to stem from what we saw in Rashi in that Gemara. Is that all correct?
That's all correct. And we're just going to clarify the Ashkenazic ruling in a second.
Based on based on the Techuya and Hutra?
Yeah. So Ravad Yosef really goes through the minutiae of that, and he defines the difference between the Techuya approach and a Hutra approach. And he says, based on the Sephardic Hutra approach, this is what's allowed, and you can kind of infer by kind of the complement of that, so to speak. The opposite of that would be true for the Ashkenazic approach. And just to read that in the Ramah, which the Ramah really is the first one that writes this set in stone, really, kind of in a binding way for Ashkenazim. Rashi is not necessarily halachic work. There are halachic decisors within kind of the Ashkenazic framework that the Ramah is leaning on. But he says, he says you would need to, let's say even a life-saving measure, he would say you need to do it with a shinoi, right? Because doing a life-saving measure, if you can minimize the isser, according to the Ramah, you'd always need to be able to minimize. And he doesn't take as permissive a role, saying that you can do everything like you would do during the week. It's brought down from a few different places. He doesn't say it as clear in his mappa, as clear on his work on Mechaber's rulings, but you can see it much clearer in the Darchei Moshe. And you can also see it very clearly in the Bir Halacha, which is pretty much the Mishnah Berurah. So Mishnah Berurah also kind of writes, he says, practically, I have a lot of paskim that say that this very permissive ruling of the Tashbetz and the Rambam, if you want to read the Rambam that way, in the Maggid Mishnah, he says the Rashi, Rabbeinu Tam, Rashba, Meiri, they're all going to say, the Arzarua, they're all going to say that this is going too far. And it says that anything that does not endanger this patient's life, anything that is not a life-saving measure, should not be done. And he says, in a case of a deraisa, that's to say, an issa deraisa that you're doing that's not life-saving, he says you shouldn't do it. Now, a derabanan, he'd be much more makel on, as we're going to see. So, a non-life-saving measure done with a shinoi or kind of as a derabanan, that's actually going to be a topic of conversation that we're going to need to really splice out. Now, but he says, by the way, in clinical practice, it's hard to figure out what is life-saving, what's not life-saving. Is palliative care life-saving or is it not life-saving? It's really kind of hard to say. Will this patient just feel better and therefore be more conducive of kind of the healing process for them to, which measure is done? So he basically says, you need to be able to prove that what you're doing is not life-saving for it to be usher. And this is going back to our Safek. If you ever had a Safek, is this going to really help the patient or not? You'd be allowed to do it. So, for example, if it's COVID and, you heard that patients that are prone breathe better, you'd be allowed to adjust the thing. If you think that this patient's getting very anxious and you're worried about them, you're allowed to make them comfortable. It's really kind of the burden of proof to prove that this is not a life-saving measure is on you to prove that you're not allowed to be Michal Shabbos. So still, our premise is you're allowed to be Michal Shabbos. You would need to use a shinoi according to the Rambam, as we're going to see that's going to be a bit of a contentious issue. But the burden of proof to figure out where is it life-saving, where is it not life-saving, is really going to fall on the medical practitioner there. And wherever there's a Safek, like we quoted from Rav Newbort, you're going to be mekel. So this is kind of a better conversation for right after Shabbos. And so you may have a question, and it may be usher to do, kind of for an Ashkenazic, for someone who's an Ashkenazi to do. Practically, that you'll only know by your next Shabbos shift. So just to summarize, only actions that are Mishnaic versions of work are biblically prohibited on Shabbos. Jewish law demands to act stringently, right? We're very machmir by pikuach nefesh. It's not that we're makel by chil Shabbos, which is very machmir by pikuach nefesh. Any index of risk, you're always going to err on the side of caution and break Shabbos. Another important thing to note is that there's a salient divergence between Ashkenazic and Sephardic psak regarding non-life-saving measures and regarding the use of a shinoi by a chedesh yesh b'sakana and by a chedesh ein b'sakana. And the modern paskim have a field day really by figuring out exactly what is risk in halacha, exactly who makes the decisions, and exactly what actions are important or not important.